If you have already read about how the diagnosis of IBS looks like, you surely know that it is not a short journey and there is no diagnostic test that can definitely confirm or rule out IBS. To diagnose this condition, tests are conducted to exclude other diseases that could cause the symptoms. In this video, I will talk about the typical tests that are recommended. However, remember that it is the doctor who ultimately decides how your diagnosis will be conducted. My name is Joanna Marciszewska. I am a clinical dietitian specializing in the dietary therapy of IBS. I invite you to watch the whole video and let me know in the comments whether you are just starting the diagnosis process for IBS or if you have already undergone some tests. First, it's worth looking at the symptoms of IBS. Main symptoms include abdominal pain, bloating, gas, and bowel movement disorders such as diarrhea and constipation. If you notice these symptoms in yourself, it is definitely worth visiting a doctor, especially if they have been present for more than 6 months. Then it is good to proceed with diagnostic tests, exclude other diseases, and then focus on treating IBS if the diagnosis is confirmed. What should you tell your doctor? Most importantly, about your symptoms, their severity, how often they occur, and whether their intensity changes depending on certain factors such as stress, what you eat, and when it all started, when the first intestinal symptoms appeared. Maybe then something unusual happened. For example, you started taking some medications, were on vacation in Asia, or had a bacterial infection. Regarding medications, it is also worth mentioning what current medications and dietary supplements you are using, and primarily tell the doctor about your family medical history. For example, whether anyone in your family had celiac disease, Crohn's disease, or intestinal cancers. There are also a few so-called alarming symptoms that are require diagnostic to be started as soon as possible. These include unintended weight loss, that is, if you lose several kilograms despite not wanting to, not changing anything in your diet or physical activity. Another issue is the appearance of blood in the stool, as well as diarrhea and abdominal pain that wake you up in the middle of the night. Other symptoms include vomiting and high fever. So if you have such symptoms, be sure to inform your doctor. Moving on to specific tests prescribed for diagnosis IBS, I would include a complete blood count, which is also regularly performed on healthy individuals. But indeed, this test can give us a bit of an overall picture of our health, as well as a TSH test, which tells us how our thyroid is functioning. If there were thyroid disease in your family, the doctor might also expand these tests to include FT3, FT4, and TTPO. Regarding further blood tests, an inflammatory marker CRP will also play a significant role here. As for stool testing, it is also extremely important. One of the common tests is a stool test for parasites, and it is important to submit ideally 3 samples from different days to get a reliable result, because parasites do not always show up in the stool, so it is worth submitting several samples to be sure. This is often extended to testing for giardia, as well as testing for occult blood in the stool. This test for occult blood in the stool should also be done multiple times, as sometimes it appears and sometimes it doesn't. Depending on the exacerbation of the disease, it is also good to check the level of calprotectin in the stool. You may have already heard this name. This factor tells us about the inflammatory state in the intestines. If it is elevated, then often diagnostics towards non-specific inflammatory bowel diseases such as Crohn's disease are prescribed. Other tests that don't involve blood or stool include tests such as an abdominal ultrasound, which should also be done every 3 years, even if you are completely healthy, and a gynecological examination for women, since some gynecological complaints can cause symptoms similar to those of IBS. Moreover, it is worth performing tests for SIBO, which is small intestinal bacterial overgrowth. And I talk about SIBO because it actually has almost the same symptoms as IBS, mainly bloating, gas, and bowel movements disorders. These symptoms often appear in some people who only suffer from SIBO. Regarding SIBO diagnostics, a hydrogen methane breath test is recommended. This is very important because it will be better than just a hydrogen test. And what is also important, even if we have SIBO, it unfortunately doesn't rule out IBS. They often like to occur together. In the diagnostic path of IBS, tests for celiac disease are often recommended. And importantly, before most tests for celiac disease, you need to eat gluten for the results to be accurate. Unfortunately, it is not uncommon that we stop eating gluten when we have intestinal complaints and only then start diagnostics. Then we may get a falsely negative result. So if you have already started gluten-free diet, it is good to discuss this with your doctor before you start diagnostics towards celiac disease. The only test that can be done on a gluten-free diet is the genetic test, which also doesn't necessarily confirm celiac disease accurately. As you can see, there are many tests, but remember that depending on your individual case, there may be fewer or more. For example, colonoscopy, gastroscopy, and various other tests depending on your medical history, symptoms, medications taken, and so on. Therefore, it is essential to consult with your doctor to approach this individually. If you want to learn more about the diet for IBS and low FODMAP diet, I encourage you to purchase my webinar. The link can be found in the description. Thank you for watching and see you in the next video.